Hi everyone, welcome back to the blog, or if you're watching on YouTube then you're equally as welcome. If you don't know me, I'm Mark, a diabetes specialist dietitian and author of diabetesdietguide.com. Now this video is all about the latest statistics coming out from the NHS that show the risk between obesity and COVID-19 mortality. Before we get going, just a quick apology about the obvious gym wear, just been out for a run, but I wanted to get this video done and edited and posted as quick as possible, so I thought I'd just crack on and get it done. So the latest statistics show us that if you are admitted to hospital and you're obese, you have a 40% increased risk of mortality if contracting COVID-19, which will no doubt be worrying for a lot of people. So this video is really just my views about it. Obviously obesity being my bread and butter, I thought I'd throw in my 2 cents, but I'd love to hear your comments. So whatever thoughts or feelings you have about the issue, then make sure you comment below, whether it's on YouTube, the blog, or on Facebook. So yes, it looks like there's a 40% increased risk of mortality with COVID-19 if you're obese. And in fact, the thinking is now starting to be that obesity is the second biggest risk factor after age in terms of mortality rates in COVID-19, which again is a worrying statistic. It's also no secret that in the UK we have an obesity problem. 2/3 of us are overweight, with 26% of us falling into the obesity categorization. The latest statistics would suggest that we're around the 3rd most obese nation in Europe and the most obese nation in Western Europe. And it's hard to lose weight, we get it. There are a lot of reasons as to why people gain weight. There's physiological, psychological, behavioral, social and dietary reasons all feeding into why people gain weight. In fact, on another lecture I do, I can list about 50 individual reasons as to why people end up with an obesity problem. So it's not black and white. But what we do know is we are the first generation that probably had to go out of their way to exercise, and our whole setup in society is kind of catered to gaining weight. Lots of convenience food, high fat, high sugar foods, lack of exercise, it all feeds in. In fact, I'd argue that it's easier to be overweight or obese than it is to be a normal weight. So how are we measuring obesity? We use a measure called Body Mass Index, or BMI. Now it's a really quick tool, dead easy, doesn't come without its flaws that I'll talk about momentarily. But essentially the principle is that we can put you in a categorization of your weight for your height, and then we can compare across different people. So you take your weight in kilograms and then you divide it by your height in meters squared. So an example would be if you're 75 kilograms and you're 173 centimeters or 1.73 meters, you divide 75 by 1.73 divided by 1.73. That'll give you your BMI. And then we can start to put you in different categories. So if you're below 18.5, you're considered underweight. 18.5 to 24.9 is a healthy weight. 25 to 29.9 is overweight. And anything over 30 is considered obese. And the further away you get from 30, the different obesity classifications you fall into. So obesity really is a medical term, and we do consider it as a comorbidity rather than just a derogatory term that we label people with. We understand BMI doesn't come without its problems, because obviously someone with a lot of muscle mass or carries their weight slightly different to other people will show up as a high-risk patient despite the fact they might not be. But of course, we're not just taking BMI at face value, we're also looking at the patient themselves, eyeballing them, we'll do blood work, we'll take waist circumference measurements, and if you have the luxury, we'll also do body fat percentages. In fact, I've worked in weight management for so long now that I can kind of get a good idea about a patient's metabolic health within a couple of minutes of meeting them. So we're not just blindly following BMI, but it is a quick tool that we can use to help categorize people and see where they're at. And in reality, most patients I'm meeting, BMI tends to put them in roughly the right category. So that's how we categorize it. Now, when we feed this into the COVID-19 statistics, it's also starting to show some patterns. The UK at the time of filming has the highest death rate in Europe for COVID-19. So it's probably no coincidence that we are also considered one of the unhealthier nations. Obviously, there's going to be other factors that feed into that, like how we live, how we work, how we're managing the disease, how we responded to the disease as a nation, how we're following social distancing and lockdown measures, ICU capacity, and also all those other different factors that will feed into it. So it's not as black and white as it seems. It's also worth mentioning that per capita, the UK is not the highest country for deaths. In fact, we come in at around 4th based on the latest data. Now, obviously, it does show us that the UK is kind of at the top tier of the tables for both deaths and per capita deaths. So really, we're not doing great compared to a lot of other countries, but then it does depend on how they're testing for it and how they're reporting it, obviously. So why does obesity put you at a greater risk of mortality with COVID-19? There's a few theories that are floating around, one being that the extra fat mass places excess strain on the lungs, another being that the excess fat mass increases the inflammation in the body, putting you at greater risk for diseases, or even that the immune system gets a little bit confused and creates a cytokine storm, which then overcompensates to fight the disease and actually attacks your own body, which then causes problems. But we can probably actually just dial it back and look at it a bit more simply. Now, a lot of patients I meet with obesity problems usually have something else going on. It's very rare that the patient just doesn't want to exercise or live healthily. Sometimes those patients come along, but more often than not, it's because they have other health conditions that over time has removed exercise as part of their daily life. So that crucial piece of the jigsaw is gone. Then, as a result, there becomes an imbalance between their calorie intake and their energy expenditure. Even if they have a pretty healthy diet, it makes it much easier to overeat. So over the years, their weight starts to creep up and they become more risky and more risky. Then we throw COVID-19 into the mix and suddenly these patients become very high risk for mortality with something like this virus floating around out there. So really, it's probably just that they are less fit and a little less robust when it comes to battling diseases, which obviously makes it very difficult for these types of patients because sometimes the choice is taken out of their hands because of these other comorbidities that prevents them from getting fit. However, if you do not have an underlying health condition that stops you from getting active, then I'd really suggest getting out there and trying to get as fit as possible, because the more robust your respiratory fitness is, the more likely you'll do well if contracting COVID-19. But we also need to put it in perspective. Now, I've been trying to search the internet and look at reports as to the hospital admission rate in the UK, and I'm coming up a bit short. I've read one report that had it at around 20%, I've read another that had it around 14%, but I can't be sure of how reputable these sources are, and the statistics aren't exactly forthcoming. If you do have them, please throw them in the comment section because I'd love to find out. But nonetheless, the vast majority of people do not end up in hospital, although I do appreciate the higher risk people will be making up a vast proportion of that percentage of people that do end up in hospital. Then our best estimates are that around 1% at the time of filming of people will die of COVID-19. So again, the vast majority of people will be absolutely fine. So you have a 40% increased risk of mortality if you're obese, if you end up in hospital, and of which that mortality rate is still only 1%. So we're still talking very low numbers. However, if you're someone that falls into the higher risk categories because of your age or your comorbidities, and you've worked out that you fall into the obese category on the BMI scale, then suddenly you start to see how the risk starts to increase. So if you did really unfortunately find yourself in hospital, then you're one of these riskier patients. Now, we can't do anything about age and we can't do anything about genetics, but as hard as it is, obesity and weight is one modifiable risk factor that we can do something about. And really the crux of it is, when it comes to obesity management, lifestyle is the key. Trying to eat healthy, create a calorie deficit from the energy going into you and the energy that you're actually burning off will help you start to shift those excess pounds. If you're able to, try and get as active and as fit as possible because that's going to reduce your risk. So almost this is my war cry for this video, that just really encourage people to try and take hold of their weight and their lifestyle, if you're able, to help reduce your risk. Because if you're already high risk, then we don't want to be playing with fire by adding extra risk factors on top of the already high risk factors that may be present with you. And I guess this is really important because COVID-19 is not going anywhere until we come up with an effective vaccine. And this could take quite a long time. So we can either isolate in our homes until that happens, which is probably not most people's preference, or we can start to reduce the risk. Now, obviously, there's going to be people out there that can't do anything about those non-modifiable risk factors, but if it's obesity, then yes, you can start to try and do something about it and reduce your risk. So one, you don't have to worry as much, and two, if you do contract the disease, actually your body's going to be much more robust in dealing with it. Now, if you really struggle with your weight, there are a bunch of useful resources on the internet. All you need to do is Google weight loss programs, or perhaps you can check out a slimming group or something along those lines. Now, obviously, this being my video, you can also check out my website and go to www.diabetesdietguide.com, where there's a bunch of free resources about managing diabetes, losing weight and eating healthy and living healthy lifestyles. If you're really struggling, I suggest checking out our programs and courses that act as step-by-step guides to help show you exactly what you need to do to manage your type 2 diabetes and at the time of filming, we're just about to publish our winning weight loss program. All our programs show you exactly what you need to do to manage your diabetes and your weight and keep the results sustainable for the long term. They all start with a diet plan that is very flexible and shows you the foods that you can eat in abundance, the foods you need to portion control, and the foods that are best avoided or limited to just the odd occasion. So they are very flexible, nothing's off limits, but it just teaches you how to regulate your diet and think about certain foods that may not be conducive to reaching your goal. Where they really earn their value though is with the additional educational material. Each program has a bunch of videos that teach you everything you need to know about nutrition, exercise, and essentially make you an expert on the subject so you don't need me or anyone else for the long term. There's also a whole bunch of educational resources in the downloadable members section. This is full of information and education about diet, lifestyle, and managing your diabetes and your weight. This gives you the best chance of keeping the results sustainable and not following that typical yo-yo pattern that so many people see when they embark on a lifestyle change. Anyway guys, that's my thoughts on the COVID-19 and obesity link. Like I say, I'd love to hear your comments. Make sure you check out the website as well. And for now, I'll leave it there, so I'll see you later.